Good morning, guys. In our routine practice, we see many varieties of cases. It doesn't fall into categories class 1 baldness, class 7, but there are many variations and many combinations we would get. This patient, we would like to highlight curly hair transplant. Of course, when we talk about curly hair, this is not an African curly hair, but Indian style of curly hair. So now in this patient, not only curly hair, we can think about it's a class 5 baldness having a rim of hairline. That's the variety of this patient. But however, we would like to highlight curly hair transplant before and after results today. That's what. Kindly watch the video until end to get some authenticated information on this curly hair transplant surgery and results. When we talk about this hair transplantation varieties, in a sense, today we are talking about curly hair. We can say wavy hair also. This curly hair, the peculiar feature we need to understand. Imagine when we have a threshold amount of density. Imagine we have a threshold amount of density in the given area. The density looks like 80 to 90%, looks like almost good. When the curly hair transplantation, if you get the threshold amount of density is very low, so threshold amount means particular amount of hair grafts in a given square centimeter which matches to that hair. So if you imagine the density is low, less than 50% in this curly hair, it looks so weird and it looks more bald. That's the peculiar feature of the curly hair transplantation. That means when we implant good number of hair in curly hair transplant, above optimum level, it looks beautifully good and looks almost 90 to 100% density. When we don't implant that much threshold amount of hair grafts in a given square centimeter, the outcome, though the hairs are grown, it doesn't match and still you look more bald, because curly hair will not blend. It simply forms the kind of whether it will show you more gaps or it will give you more density. So that is a tricky part of the curly hair transplantation results. So this patient actually, when we walk into our office, he had a very short haircut in the backside. We cannot analyze the nature of the hair actually. So when we harvest the grafts are little curly. That means this man has a curly hair. So when we plant such a way that he had even a very fair skin color, that means we need more grafts. So we always wanted to implant optimum number of grafts which is supposed to show good density. So that's what we need to understand in this kind of patients. So that means a simpler manner, we need to implant more grafts. We need to implant more grafts because of two reasons. Number one is a very fair skin. Number two is curly hair. Otherwise, this transplant doesn't look good. So that part of the tricky issue we need to understand and plan such a way that which area you need more grafts, what is the angulations we are going to give you. So to achieve better camouflage, these are the few things we need to understand. That kind of patient, he approached me for that transplantation on observation. On examination, he had a beautiful donor. That's the advantage in this patient, and we could able to do more grafts. And the plan has been designed such a way that we are going to get a more density in the mid scalp, on sides, other sides. Because when you have a silky hair and kind of a wavy hair, it will blend. Whereas curly hair doesn't blend much. So that is the reason we need to implant the hairline as well as the mid scalp on both sides, lateral sides. That's what we plan for this patient. Another important point when we talk about results in curly hair pattern hair transplants, so we need to wait more time. Unlike other hairs, silky hairs, we need to wait more long time because the curly hair, even it grows 5 centimeters because of the nature of the curly. It just looks like only 2 centimeters length. That means we need to wait for a normal transplant where you're supposed to wait 8 to 9 months. A curly hair, you need to wait 9 to 11 months, even 9 to 12 months to see a better outcome. So like that, we achieved a very best density after 10 months in this patient. And of course, it is not 100% density. It looks like 100% density. It's because we implanted and achieved such a way that better camouflage in these patients. So, utilizing the nature of the curly hair, we need to plan the transplantation. And that's how we're going to get the beautiful and phenomenal outcome as we shown in this patient. You can see the frontal hairline volume, bulk, and even the lateral side, both sides, left and right. That looks so awesome. And we gave a little less density in the crown part because to conserve the grafts and get more density in the frontal area. So you can still see the full coverage in the crown area as well, and donor maintained very well, as simple as that, because the donor is most important to protect. So all the parameters in this patient we did very meticulous manner and achieved the best outcome. And this is the points which should be noted in this patient: is a very fair skin, curly hair, and large scalp. Still, we achieved a best outcome in this patient with a very a crucial and meticulous plan that is done with our experts in our center. So, what is the conclusion in this kind of patients is we need to understand basically a kind of what kind of skin color and hair color are we treating with, because the skin and hair contrast has to play an important role in getting the better camouflage. And another point is what kind of hair nature, what kind of grafts do we have in these patients. I mean, do you have a single grafts, multifollicular grafts, and what is the skin color, what are the angulations we are going to achieve. Before transplantation, we need to look at the patient front, lateral view, all the angles, what is the patient height, everything that matters. Accordingly, we need to design the transplant density, and so that we're going to achieve a better coverage, a better camouflage. So here we did little more density because of the curly hair, and we achieved the density only after 10 months. And that's the important point you need to understand about each person. So we are here to tailor depending on the patient needs. We tailor their plan and surgery steps, whatever it is. So we diagnose and plan according to each patient, not like every patient. Okay, each patient has a different kind of a head shape, hairstyle, and even skin color. These are the important points we do take care every day while doing hair transplantation. So keep watching for more authenticated videos and hair transplant results. Thanks so much.